Hi, I'm Sue Ivy, Calian's Chief Human Resources Officer, and I have the pleasure of being here today with two colleagues, Richard Moreau from our Emergency Management team and Wes Karges from our Health team. I'm going to kick us off today by walking through our response to COVID-19 at a very high level, given we're still in the throes of things. Richard is going to talk about incident management, and then Wes will talk about getting back to work, some important health and safety considerations. So I'll get us started with who we are. So Calian employs more than 3,000 people, and we deliver solutions to both private and public sector customers. Our operations are based across Canada and in Europe, and we offer a diverse capabilities and expertise in the areas of health, learning, emergency management, information technology, and cybersecurity, and advanced technology, which includes manufacturing. And we're publicly traded on the TSX. So we'll stick on this slide for a second, Richard, and I'll maybe talk a little bit to our response. We really got started at the beginning of March. We could see it coming earlier in the quarter, but we had very little appreciation for what was actually coming our way. At the beginning of March, we had several people traveling, including a fairly large contingent at a trade show in Washington. The group included employees from Ottawa, Saskatoon, and Germany. And the issue of COVID-19 really continued to build as we experienced an employee in one of our smaller offices feeling unwell. This is what suddenly made the whole COVID-19 crisis become real for us. So we sent that office home with their laptops in their bags in about 20 minutes. And while we investigated the concept of notifying public health and making sure we had a clean facility for our employees to return to, in the meantime, the employees sort of did their testing and what they needed to do. And then 2 days later, it happened again. So we thought to ourselves, we really can't do this every other day. And so by Friday, I think it was about March, middle of March, around the 12th or 13th, by that Friday, we'd had our second incident. And by the middle of the afternoon, we sent the lion's share, a good chunk of our workforce home, and we were off to the races in terms of testing our work from home protocols and systems. So if we flip to the next slide, Richard, what we did is we really focused on three key points. We really focused on our people, our customers, and our business. And this really came to us from our mission statement. The other thing that was relevant to us was our core purpose, which is we help the world communicate, innovate, stay safe, and lead healthy lives, which is particularly appropriate at a time like this. So it all seemed to fit together, and what was important to us is that we had an employee-first response. They really are the heart of our business, and we need to put them first. So right behind that was our customers and what was their status and how could we help each other. Many of our employees deliver solutions right from customer sites, so we needed to align and coordinate quite quickly. So finally, we needed to be concerned about our business. How would we monitor and manage it? Things for everybody's sake through what has proven to be fairly turbulent waters that we've been navigating. So I can show you a little bit of that response, that organization on the next slide. If Richard, you want to flip to that one. So the organization came from the organization for that really came from our business continuity plans. We have a three-level response. The first one is really focused on geographically specific areas. The second level for us is really focused on a particular area of the business. And the third is really a global pandemic level, which this obviously was. And so we jumped right to our level 3 response level. On the next slide, you can see sort of a description of how we've been managing. So on the left-hand side of the slide, you can see sort of our tiered levels and how we cascade communication through the organization. And then on the right-hand side, you'll see what we built very quickly, which is our incident response team. Now, we're very lucky at Calian because we have the likes of Richard Moreau and several other supporting cast members who are able to jump in and provide leadership in an area and at a time like this. So on the right-hand side, you can sort of see that what we did is by building this team, we really had a team that was focused on COVID-19 and what it means in our context. So they generate a report that is reported on daily that serves the purpose of providing the leadership teams with a very joint understanding of what's happening. And then that team also has the ability to analyze the plethora of data that's come at us since all of this started, start to digest some of the various announcements that have come out, and then plan for some of the contingencies that will be up and coming. So my day really starts with a meeting with all senior leaders at Calian. That includes the corporate leadership team, as well as the leads from each of our service lines, as well as sort of some other folks who have been very key to our response, like our communication teams and our corporate affairs teams. It's then bookended at the end of the day with a corporate leadership team meeting where we report back on what's happened through the day. And this structure has really allowed us to cascade information throughout the organization and make sure that everybody knows in a timely fashion what they need to know when they need to know it. So if we flip really quickly to my last slide, I'll talk to you a little bit about our early success. So I would say that our first and foremost point of success has been leadership engagement at all levels, especially at the top. We have an exceptionally passionate CEO about the business in general, certainly about the people within it, and ensures that that we have really maintained a focused an interest and a focus on what's happening with COVID and how it is impacting our people, our customers, and our business in general. The second point is around communication and meeting governance. That meeting structure, as onerous as it seemed in the beginning, has really become a very comforting way to sort of start and end our days. Our meetings at this point are down to as quick as 15 minutes, and depending on the issue of the day, might go as long as 2 hours for some of our CLT meetings. But the meetings are organized, they're in our calendar, and they are sort of an expected tempo to our operation now. We've got a coordinated team, and we've got the right talent doing the right things. That IST team has really, it has within it representation from all areas of the business, all levels, all different sort of facets, so that we can really start to see into the nooks and crannies of the business and design our response appropriately based on that. The other important thing that we have experienced success in is just reflecting our culture. We're people first by nature, and so putting them front and center on this response was the right thing to do for us. We've also been very transparent, very honest, and pretty humble in our communications. We've made mistakes and we've fessed up to them as we go. And the other thing we've done is we've tried to have some level of fun with it. We've done some communication, some of it more serious, some of it a little more fun in terms of just trying to get a pulse on the business. So we've done that through technology and through our Response Ready tool in terms of collecting feedback, and we ran a mental health survey to really understand where our team was at and how this whole change has been impacting them. And we've also run just some fun questions to kind of engage as people suddenly work from home, and many felt very isolated. We've tried to find different ways to engage with our population. And then the final point is just communicate. Holy smokes, we can't understate the importance of communication and how it's helped our response and our team sort of continue to make it through this pandemic. So with that, I think I shall pass it off to Richard, who will walk you through the more robust version of incident response. Thanks.
Thank you. So again, my role before COVID unfolded is I'm the Director of Business Development for Emergency Management Practice. In order to manage our incident management structure, I was kind of seconded to corporate services to help manage the day-to-day handling of COVID, and as well coordinating the efforts of the incident support team, reporting directly to the corporate leadership team, in particular through our CIO, Jerry Johnson, who also acts as the enterprise risk manager champion for Calian. So as Sue alluded to earlier, we activated our level 3 response on March 12th. And the first 3 weeks of our response was really focused on getting a good sense of the status of our workforce, how they were being directly, immediately affected by the onset of COVID-19. And this was particularly challenging because we were at the time of the year where people are traveling on their spring break. So we had lots of people that were out of country on holidays. Some of them ended up being stranded for some periods of time outside the country as they got caught behind the shutdown of the airspace and borders. So mission number 1 was to find out the status of our workforce, and then quickly establishing our clients were being impacted, how we could work with them and help them, and also at the same time assessing the business continuity aspects of our operation. Also quickly into the mix, as Sue mentioned earlier, we have a manufacturing operation in Saskatoon that is closely linked to the defense sector in the strategic communications field, which was declared an essential service by the federal government. So right from the get-go, we had to contemplate how to maintain our workforce in a manufacturing setting with the appropriate amount of support and corporate functions on site in terms of oversight and also engaging with our different suppliers to maintain the integrity of our supply chain. So that was something new to us, and that was really the first challenge that we faced early on into the crisis. As the situation stabilized, we found ourselves in the first week of April, where we had now settled into more of a routine with our daily briefing rhythm to the management of the company, keeping them aware of how things were unfolding across the country and overseas where we have operations, in particular, in our case, in Europe. So the incident support team, which was made up of representation from all the key corporate services, government relations, comms, finance, HR, and then from each of the service lines, we were able to use that construct to manage the information. And what I mean by managing the information is in an era of social media and online media presence, it becomes very difficult early on to establish what is ground truth, what is real, what is not, what is fabricated news, and so on. So the first thing we did is establish what we call our trusted sources of information. And for us, we had to establish ourselves as the trusted source of information for our employees. So to facilitate that, we stood up our own intranet site that became our communications platform for daily updates and key messages that we wanted to push out to our workforce. So that was a key enabler to our ability to establish ourselves as the go-to source of information to keep our employees from going on Facebook or whatever platform to get their information from. We needed to establish ourselves as a trusted source of information. So we did that early on, and we have maintained that throughout, and we continue to do so. The next step was now, okay, we've got things under control. Things are going fairly well. Our workforce has generally made the transition to working from home quite successfully. Our IT backbone has been capable of supporting the workload with very few glitches. So now that we knew that we could function efficiently and effectively in that environment, we recommended to the senior management team and the corporate management team to now turn our efforts to contingency planning, focused on return to work and then recovery. And we've purposely separated the two because we felt the return to work was more the short-term to immediate requirement of gradually bringing our workforce back to work, either at Calian operated work sites or at client sites. And then the longer term, the mid to long term impact of COVID would be addressed through the recovery. So the long-term monitoring of the health of our workforce, how the new normal will affect the way we work, the way our clients buy, purchase or acquire our services, what type of services. That was going to be part of the recovery. So we developed some scenarios, a more likely scenario and a worst case scenario on the impact of COVID on Canadian society. And we used that as bookends to develop our plan. The biggest challenge we had from the get-go is we had to deal with all provinces and territories and a different national government. And on top of that, many of our clients are federal clients, which tend to work under their own guidelines. So the challenge for us was, how do we assess the different provincial work plans in order to establish that we're confident that the resulting risk exposure from each plan to our Calian workforce was being minimized to a level that we were comfortable with. So we, as we will see in a few minutes, we decided to take a risk-based and criteria-based approach, and we use that methodology to assess every single provincial plan for reopening or return to work that was published in the past month or so, including any federal guidelines. And then we use that as the baseline upon which we build our own return to work plan and guidance for our managers, for employees, and for our contract managers that interact with our clients directly. So that got initiated on April 16th, and the team started to develop the document. The final draft is being reviewed right now and will be released across the company next week. So this is the framework that we use for our planning, and this was based on the scenario that was briefed by the Public Health Agency of Canada in terms of how they saw us beating the curve or flattening the curve between now and the end of the year. So currently we're in the May timeframe, the second red star. But as you can see, we are also prepared to go back to where we were several weeks ago in the event we get outbreaks starting up again, or a second wave. So the monitoring throughout will be very important. Having the right protocols in place to quickly identify issues in the workplace, and clamping down immediately with the right, with reimposing or reestablishing the right level of measures on a case-by-case basis is essential. So that's part of our plan. And as you can see, we are transiting now that our plan is ready to go, with the understanding that our plan will be evergreen and will continue to evolve in the next little while. So this slide just provides more details. So I'm not going to go through it in great details, but the bottom line was focused on actions we needed to take, impact on the business, and the planning activities that are required at every step of the way. So I talked about the criteria base. We consciously made the decision that we need to identify certain preconditions that must be in place before we allow our employees to reintegrate client work sites or come back to our Calian operated facilities. We also developed our own 4-stage plan, with stage 4 being the recovery. And we basically benchmark each provincial plan against that, and then adjusted locally as required. And so far, the only jurisdictions we've had to make those adjustments was with Saskatchewan, because they were the first ones to announce their plan to reopen the province. So our criteria are very simple. We use the first 6 are right from the World Health Organization, and those speak to the preconditions that need to be present for us to be comfortable that our employees can reintegrate the workspace. 7 and 8 are additional ones that are specific to the plans, and what we were looking for in each provincial plan is clearly articulated metrics and criteria to initiate the plan and then to navigate from phase to phase. So this is the tools that we use to assess each of the plans and the categories that we looked at. So on the left-hand side, the types of measures that we were contemplating, and Wes will get into the details of the occupational health and safety aspect in a couple of minutes, is we looked at the measures that needed to be in place for us to initiate. What would be a return to work posture? So how many people, what kind of shifts, essential workers only, how many people per team, physical distancing measures, and everything else. And then we looked at the occupational health and safety front, the communications required to support this, what would be our protocol to deal with new cases, and how we would manage any outbreaks of cases in any of our facilities or at client sites. So that was for client sites. The other challenge we had is at some of our facilities, we quickly discovered that we need to fully engage our landlord or property management company to see what they're going to do. And in a multi-tenant environment, you also need to coordinate with the other tenants to make sure that there's some consistencies in the measures being applied, so we don't work at counter purpose. The only additional things that we had there was logistics requirement, because now we are responsible to provide PPE, signage, and so on at our own operated facilities. And that was the only difference between that and the clients. So overall, for every single provincial plan, is we followed this risk assessment structure. So on the day that we were presenting, we provided an update on the situation in the province. We did an overview of the provincial plan. We provided an assessment of the plan against the 8 criteria that I've identified for you. We've assessed the potential risk exposure to Calian employees and systems for each of those 8 criteria against the provincial plan. We identify mitigation measures to implement to mitigate that risk, and then looked at how we would harmonize our measures so they were in full respect of what was being done at the provincial level. And then we developed an action plan and a communication strategy for each of those. So that is the overview of what we did in terms of the incident management side of it. I will now pass the microphone to Wes, who will cover the health aspect.
Thanks, Richard. I appreciate it. As Stu mentioned, my name is Wes Karges, and I typically work on the business development side of things with Calian's Health Services Group. But over the last couple of months, I've been involved working with clients to implement occupational health and safety programs to keep their employees safe on the work site, both throughout the duration of the pandemic until now, and then as the economy opens up going forward and more and more people return to work, developing programs to meet those needs as well. So I'm going to just chat a little bit about some of the occupational health and safety concerns and some of the goals of employers going forward, and then I'll touch on some of the strategies on how to mitigate some of the risks going forward as well. So I think my main point to start is that COVID-19 OH&S concerns are very, very valid and very real. The primary concern on everyone's mind, I think, is physical health side of things. So the potential for rapid community spread within a workforce. And we've already seen examples in Canada here of massive spread within workforces. And I think I speak for all employers that they don't want to be the center of that. And I think I can speak for all employees that they don't want to be a part of that either. So that's concern number one. Concern number two on the physical health side of things is how do we protect vulnerable employees going forward? And that's been a real concern of some of the clients that we've worked with. Not all employees have the same health status. So how do you differentiate between employee A and employee B and ensure that employee B, who may have a chronic condition and be classified as a high-risk individual, is protected when working within the rest of the workforce? And then I think the third point on the physical health side is that there's no vaccine or overly successful treatment identified at this time. So there's no fallback mechanism if there's an outbreak within a workforce. So what are we going to do to mitigate that risk? Mental well-being is also a big concern. We're seeing it with some of the employers we work with as well. Stress and anxiety from returning to work, and maybe the new conditions at work that are implemented due to COVID-19 could lead to stress and anxiety within a workforce, and this leads to a few issues. It can affect workplace performance, and then it can also have an effect on workplace safety as well. So the next main point is that occupational health and safety will significantly influence business operations. We've already seen that happen, but even going forward, it will continue to affect the day-to-day workings of employers and companies as more and more COVID-19 risk reduction strategies are implemented. And we know that government mandated OH&S practices could also interfere with business as usual. Now, we don't know what those look like in their entirety, but there's already some, and I think we can reasonably expect more. And so that said, I think it's clear that the success or failure of an organization's OH&S policies when it comes to protecting their workforce from COVID-19 will impact the bottom line and will have a serious consequence on financial outcomes. So if I could go to the next slide, Richard. So this next slide just outlines some key goals to think about when you're considering bringing a workforce back into the workplace or returning to quote unquote a new normal within the workplace. And I think obviously the first goal that people think about, and certainly the clients that we've worked with have thought about, is protecting the health and well-being of the workforce. That's absolutely paramount, and it's consideration number one. Number two, I would say, is protecting the health and well-being of the customers and the public that your workforce interacts with on a daily basis. That's also essential. Another key point or another key goal to consider is the compliance with government regulations that may be coming. So ensuring that you're in compliance with those and that any enforceable regulations are being adhered to. And then, as I mentioned just in the last slide, ensuring business performance and continuity, making sure that the workforce is in a healthy state such that business goals can be obtained. And then the last point, and I think Sue touched on this too with Calian's people first approach, is just maintaining employee confidence throughout the process, ensuring that employees feel like their employer is willing to spend the time and maybe spend the resources to ensure that they feel protected and safe while they're at work. So next slide, I'm sure. So the next couple slides are just some strategies that we've implemented with our clients and even at Calian to protect the workforce and ensure OH&S compliance going forward. So this first slide here, it just touches on some essential strategies, and I think these are probably appropriate for almost every workplace. I don't know if there'd be any exceptions to this. So obviously the first one is facilitate and enable social distancing. So just what we've been doing for the last couple of months, keeping 2 meters apart, staggering breaks and lunches so there's less communal interaction, spreading out desks and workplaces if at all possible, minimizing inter-facility travel. So for example, if someone works on floor 1 and there's a second floor, perhaps you set up your facility such that they can't go to the second floor unless required. And then also another strategy that's widely used is having dedicated site entry and exit points that are separate from another. Obviously, employers want to encourage proper personal hygiene when their workforces gradually return to work. So frequent hand washing is point number one there. And then also letting employees know that if they are feeling well or sick, that they should stay home, and that should be an encouraged attitude within the program. Industrial hygiene is obviously another point to consider. So identifying and disinfecting fomites, especially in high traffic areas, determining the level of decontamination and cleaning necessary for each work site, and also determining the availability of cleaning material for communal and individual workspaces. So determining who's going to clean desks, who's going to clean communal areas, who's going to clean the break room, and things of that nature. In the next slide, Richard, if you can move there, we'll talk about some secondary strategies that maybe are a little bit more advanced and certainly offer a little bit more protection to the workforce. And these would really be dependent on the nature of the workplace, the work that's being done in the workplace, and the industry as well, as certain industries are certainly prone to greater interpersonal contact and greater risk of an outbreak. So the first strategy that we've seen and we've worked with some of our clients on is mandatory PPE. Masks is probably the first thing that comes to mind. So if it's appropriate and feasible and practical, ensuring that all employees are wearing masks at all times while on site is a strategy that can be used. Another strategy is off-site screening. So before employees show up to the office or show up to the warehouse or whatever the work site may be, completing a questionnaire before they leave their home, even to determine their eligibility to show up. So that's typically done via a mobile app or a web app, and there's a questionnaire that can be associated with that, whereby they can determine if they're suitable to return or to go to the workplace that day. The next strategy that can be used is on-site screening and testing. So this typically consists of a questionnaire and a temperature screening upon arrival to the work site. Typically, we've done this with healthcare professionals, both nurses and paramedics, and that can determine if a person is eligible based on those requirements to participate in the work site on that day. I did want to touch on rapid testing on site. I think it's not quite available yet, but it's something that's certainly likely to be available in the near future, or at least in the midterm. So that's another strategy that can be incorporated to this on-site screening and testing. The last two items are site access tracking and contact tracing. These are typically done via technology as well. So having mobile platforms or web platforms that employees or staff can download on their mobile device and carry with them throughout the day to determine who's on site, when did they show up, when did they leave, and who did they come in contact with. And that's really beneficial if there is an outbreak of COVID-19 in the workplace. You can eliminate individuals who may not have a high risk, and you can identify individuals who may be at a higher risk of contracting COVID-19 and additionally further spreading that. So next slide, if possible. I think there's a lot of great things that can be done, but I think I want to be clear that there's no silver bullet to these strategies, and most occupational health and safety plans will require multiple strategies to effectively protect employees in the workplace and reduce the COVID-19 risks present on site as well. So on the next slide, there's just some things to consider, and these have been questions that that have come up through our work with some of our current customers who we're helping implement strategies for. Questions like who will monitor the compliance of the programs? How will the organization deal with employee medical information has been another significant factor and concern and should be well thought out before implementing programs. What level of PPE will be required if that's deemed to be a strategy that is appropriate? Is it going back to the mental health piece? How will organizations and occupational health and safety teams monitor the mental health of employees? As Sue mentioned, we have a response rating platform here at Calian that takes a survey, and that's how we did it. So employers will want to make sure that they have similar capabilities going forward. And then if there is issues or problems with mental health concerns in the workplace, what support is in place to address those concerns. So on my final slide here, I just want to go over a few ways that Calian can help and how we're currently helping some of our customers in this space. So we can help implement and manage screening programs, both on-site and off-site. We do them at key points of entry. We use experienced healthcare professionals who do the screening, take the questionnaires, and ensure compliance at the access points and on-site. We have technology available to do site access management and contact tracing. We also have developed a robust supply chain for PPE procurement. So if organizations are struggling to source PPE, that's something else Calian can help with. And then on the mental health side, we do have a national network of mental health resources that can be leveraged to address any mental health concerns that are COVID related in nature that arise in the workplace. So with that said, I'll hand it back over to Richard to summarize and close out.
Thank you very much, Wes. So in conclusion, some of the key points from this afternoon's webinar is really you need to get ahead of the situation, gain control, and establish how it's impacting your organization. Set your priorities and begin planning early for the next stage. The sooner you can establish your planning for the next stage, the easier your transition will be and you will have more time to react than if you wait to be reactive. So a proactive approach here is highly recommended. Have a clear process and timeline and follow it. It's very imperative to adopt a criteria-based and risk-based approach to guide decisions and choices along the way. Senior management needs to be engaged early and often, and you need to have a champion for your incident management function within the highest level of leadership in the organization. You have to leverage collaborative work in this virtual workspace environment in order to enable some of the processes that are in place. So the earlier those are set up and running, then the more efficient your team will be. Keep it simple. And as we said, communicate early, communicate often, be flexible and adaptive. So thank you very much for your time. And if you have any questions, then you can reach out to any of us. We'll be more than happy to assist you with your needs. Thank you for your attention this afternoon.